So let's monitor if the baby is not in pain. So now, since the baby is sleeping, he is not in pain. So now, the first thing to do is to auscultate. We're gonna use the bell of the stethoscope. So we're gonna listen to his heart. So a normal rate is between to 120 to 160. So it is very important to listen for a full minute. So far, for me, I will do some 1 minute listening because it will take long time. So I will just demonstrate it. So next is to listen to the baby's lungs. We're gonna use again the bell of the stethoscope from side to side. The next is the respiratory rate. While listening to the lungs, we could take the respiratory rate. Then the vowel sound. Of course, the baby have do vowel sounds after 30 minutes of blood. So the big three vitals are heart rate, temperature, and respiration. Since we are done with the listening, now we'll start with the head to toe. So now first let's take off the baby's hat and put it in the side. Okay, just take your hands, run over the baby's head like this, and then feel um, his hair. Okay, so now we are done with the head. Let's go to the eye. We'll be using the pen light and run over the baby's eye. So since we're gonna force the baby's eye to open, let's just take it easy. Okay? So okay, now that we're done, next let's check the ears. So the ear should line up with the eye. This. And that's good, okay? Um, and now let's check the mouth if the baby sucks your finger. So he's doing a sucking reflex. And then, so look the first, okay, observe the baby's breathing and the other side. Okay, so far the baby's breathing is normal. So if you can see, the baby has fluids in the nose. That's because it's a cesarean baby, and that is also normal. So moving down, checking the baby's neck for weaving baby vernix are hiding like this. So just do it slowly. Next is chest. So we will check the chest. So we won't open this because so we will just check for the discolorating and checking for the skin in his arms. Okay, on the other side. So far it is normal, and it is normal for the babies to be skinny. When we check fingers, we have to count it from 1 to 5. Okay, let's count 1, 2, 3, 4, 5. Okay, it's complete. On the other hand, 1, 2, 3, 4, 5. So far it is complete, and next we're gonna check the formal grabs. I will put my index finger here. So um, if the baby will do some reflection, then it is normal. Then on the other side here, okay, it is normal. Next is as we work down on our way to check the baby's legs. So we will check the baby's leg. Okay, um, the skin is normal, and on the other side, okay, it is normal, and her feet. So we will now count again like we did in her fingers and hand. So we'll count from 1 to 5. 1, 2, 3, 4, 5. So just take it slowly. The other side. 1, 2, 3, 4, 5. Okay, so far it is complete. So if the baby is girl and a term baby, you might see a little white stuff in the vaginal fold here, and that's called a smegma, and that is normal. So it is fine with the baby. Don't scrub it or wipe it off. Also, baby girls sometimes have subtle menstruation, which when changing diapers, you see a little blood in diapers here. Okay, so that's mom hormones secret circulating through the babies, and so that is normal. So if the baby is a boy, then we're gonna be checking the penis. Um, so we will gonna check the penis, the meatus where urine comes out. So that should be on the tip of the penis. It could be another side, which is hypo, hypospadias, or at the top called epispadias. So both things are not normal and needed to be checked. So always remind them. Now, if the baby is circumcised, we're gonna give the proper instruction to the mother. We're gonna need to test the testicle, make sure um, it's decent. So we're gonna assume that this is the penis of the infant. If we see that the urine is super dark, sometimes they mistake it as a blood, but that's okay. So um, the urine concentrated and like urine acid crystal, but when it comes to bowel movement of the baby's makanyan is like greenish, black, and twilight. Very sticky, sometimes even wipes can't take it off. As the baby grows and start eating, it's gonna vary depending on the breastfeeding of or formula, and that considered normal baby. It can be brown, tarry bluff, green, and yellow. So now I'm gonna be wrapping up the diaper bag. So make sure, so we have to make sure that um so check the curvature of the spine here. Then check the butt and look for the Mongolian spot. So that a normal mark. So there's nothing to worry about. And its color as well, check if this is yellowish or blush there. So we're gonna put down again the baby um, slowly. Okay. So now that we are done checking the baby's back, let's proceed to the last assessment, which we're gonna use the thermometer. So we will check the temperature of the baby. Okay, we're gonna do like this, then put um, it in the baby's underarm. Then so just wait for a second. Some babies will be get irritated because they we touch their hands. So just take it slowly. And then we're done. We get the temperature of the baby. And now we're gonna um put back the hat of the baby. So now we're done to all of our so now we're done to our all assessments. We will now do the document findings. So next we're gonna do the aftercare for the end part. And that's all for today. Hope you learned something and thank you for watching.